Welcome to the Stroger Hospital Training Module number 4, Infection Control Cleaning Procedures for Environmental Services Workers. The information you will be receiving in this training module is critically important to your duties and your work responsibilities at Stroger Hospital. We're glad that you have taken time out from your busy work schedule to take part in this important training session.
Before we get into the details of how we accomplish infection control through our cleaning work, let's first review the goals and the topic we will cover in this training module. Our goal is to understand the critical importance of infection control for the patients, visitors, medical staff, and also you and your coworkers in Stroger's Environmental Services Department. To achieve these objectives, your personal training goal in this module should be to develop and understand what are the best practices to achieve infection control. You should also pay attention to what are bad practices that can compromise infection control and how to avoid them. Subjects we will be covering include knowing that there are 3 different infection control levels, depending upon the area of Stroger Hospital that you are cleaning. These levels are classified as high, intermediate, and low, and each has a corresponding level of cleaning and disinfection intensity. The importance of hand washing, hand hygiene, and glove use, and the critical role this plays in infection control. The do's and don'ts of medical equipment cleaning. Developing your work strategy for identifying and disinfecting high hand touch areas in patient rooms, procedure rooms, and other areas of Stroger Hospital. Adapting your cleaning and disinfection work to any special patient care areas you may be assigned to clean, like the intensive care unit, often called the ICU, the nursery and patient isolation rooms, bloodborne pathogen and bodily fluid cleaning and disinfection, performing carpet cleaning, including daily vacuuming, spot cleaning, and extraction cleaning. And finally, we will talk about the subject of botanical decontamination, or more simply stated, minimizing the microorganisms that can develop at Stroger from cut flowers or plants that guests bring into patients as get-well gifts. Let's begin.
How important is infection control at Stroger Hospital? Each year, thousands of Americans acquire serious infections and illnesses from their stay at hospitals throughout the country. Some of these infections can be very serious, even life-threatening. They are called hospital-acquired infections by healthcare professionals. In news media reports, the scary word superbugs is used to describe the viruses and infections patient and healthcare workers can catch if infection control is not properly practiced. You may have heard of some of the more prevalent types of hospital-acquired infections by name. They include methicillin-resistant staphylococcus, also called MRSA, Clostridium difficile, also called C. diff, and necrotizing fasciitis, also called flesh-eating bacteria, and there are several others. These hospital-acquired infections have scary names because they are serious and life-threatening. The good news, however, is that by following good cleaning and disinfection practices, we can minimize the chance that infections like these can occur. At Stroger Hospital, our mission as EVS employees is to follow these practices each and every day in our effort to prevent hospital-acquired infections.
One of the first steps in practicing good infection control cleaning is to know your work assignment and plan your cleaning tasks, tools, and cleaning solutions accordingly. With regard to your cleaning solutions, knowing what level of infection control disinfection is required in the area of Stroger Hospital you are assigned to clean is critical. High-level disinfection requires the use of a sporicidal chemical that is highly effective in quickly killing all microorganisms on surfaces to be cleaned. At Stroger, the sporicidal we use is CaviWipes 1 or CaviWipes 3, disposable pre-treated wipers. The number 1, or 3 in the CaviWipe's name indicates the number of minutes of wet dwell time that the sporicidal CaviWipe solution takes to kill microorganisms. Wet dwell time is the amount of time that the surface wipe needs to be wet for the full microorganism kill. High-level disinfection areas at Stroger include operating rooms, surgical procedure rooms, ISO rooms, ICU rooms, the burn unit, or sometimes called the step-down unit, and the prenatal nursery. If you are unsure of whether or not a room is classified as high-level disinfection, ask your supervisor. Intermediate level disinfection requires the use of a germicidal solution. At Stroger Hospital, we use neutral disinfectant cleaner in these areas. Please note that neutral disinfectant cleaner requires a 10-minute wet dwell time to effectively kill microorganisms on the surface you are cleaning. Apply the solution heavily enough to allow for a 10-minute wet dwell time, then wipe clean afterwards. Areas where intermediate level disinfection is performed include patient rooms, clinics, nurse stations, and nurseries. Low-level disinfection areas will also require the use of a neutral disinfectant cleaner as the appropriate germicidal solution. These areas include lounges, offices, break areas, waiting rooms, and other public areas of Stroger Hospital. Always remember, if you are unsure of the level of disinfection cleaning required in an area of your work assignment, ask your supervisor.
Did you know that one of the most effective means of achieving good hospital infection control is proper and frequent hand washing? It's true. Study after study shows that because our hands come into contact with so many objects and surfaces, they become carriers of millions of microorganisms. These same studies show that thorough hand washing helps eliminate these contaminants from your hands. This is especially true for environmental services workers because our hands are always busy working on cleaning the things that harbor germs and viruses. As a Stroger EVS worker, plan on washing your hands very frequently during the course of your day. Plan on hand washing and regloving after each time you complete the cleaning of a patient room, procedure room, or any area of Stroger, and before you enter the next area you are about to clean. After cleaning a bathroom, this means you will wash your hands 2 times for each patient room you clean, once before you enter the room to begin your cleaning, and once after you clean the patient's private room. After your own personal use of the bathroom, before and after you have a meal, after shaking hands with someone. Really, for infection control, you should avoid handshakes. A simple fist bump is much better for infection control. Always wash your hands and reglove after coughing or sneezing, and always after handling garbage or waste.
Not only do you need to wash your hands frequently, you need to do it correctly in order for your hand washing effort to positively impact infection control. Hand washing is not just a matter of a quick lather and rinse. Your hands need to be scrubbed, rinsed, and dried thoroughly. Also, you need to wash and rinse for a long enough duration to actually remove harmful microorganisms. Finally, immediately after drying your hands from washing, you need to put on new, fresh gloves before you touch anything else. Don't forget this important step. For a detailed step-by-step description of hand washing and hand hygiene, see the Stroger Hospital Training Module Number 3, Hand Washing and Hand Hygiene for EVS Workers.
Some portions of medical equipment may require your cleaning and disinfection attention. Generally, as an EVS employee, the portions of medical equipment that you may be required to clean are the non-electronic stands, poles, and pedestals that hold or support medical equipment. Examples include IV poles, equipment stands, patient bed frames, and blood pressure cuffs. Examples of equipment you may not clean include electronic and technical equipment, MRIs, lab equipment, and bedside monitors. As with other surfaces, use either CaviWipes or neutral disinfectant cleaner in accordance with the type of room you are cleaning. If you are unsure about whether or not you should clean a particular piece of medical equipment, check with your EVS supervisor.
To accomplish effective infection control cleaning and disinfecting, your work should focus on what we call the high hand touch areas of the room you will be cleaning. What are the high hand touch areas? Look around the room. Observe the use of the room and visualize the spots and surfaces that patients, medical staff, and visitors touch frequently with their hands. Examples include doorknobs, bed rails, light switches and light switch plates, toilet handles and sink faucet knobs, armrests and furniture, IV poles, edges of the privacy curtain, counters, cabinet handles, bedside food trays. Can you think of other objects or surfaces that are high hand touch? Clean and disinfect these high hand touch areas using either a neutral disinfectant cleaner or cavi wipes in accordance with the type of room you are cleaning. As you clean and disinfect, remember to allow for adequate wet dwell time for the disinfectant solution to kill microorganisms. 10 minutes of neutral disinfectant cleaner, 3 minutes of cavi wipes 3, and 1 minute for cavi wipes 1.
Examples of special care areas consist of operating rooms, isolation rooms, the burn unit, also known as the step-down unit, and the prenatal nursery. Because patients in these types of rooms are more vulnerable and sensitive to the potential of an acquisition infection, we must clean with a high level of attention to disinfection. Also, before entering any high-level disinfection area such as these, remember you must perform thorough hand hygiene, and you must wear additional personal protective equipment, including gloves, hair cover, masks, coveralls or jumpsuits, and possibly eye protection. In special care units, use Clavi Wipes 1 or Clavi Wipes 3, applying the solution with the pre-moistened towelette, and allow for the 1 or 3 minute wet dwell time for full disinfection.
Whether cleaning an area requiring high, intermediate, or low levels of disinfection, you must use the proper techniques to achieve the microorganism kill for effective infection control. Our goal is to clean and disinfect. First, you must clean all visible dirt, grime, dust, fingerprints, and smudges. There is no such thing as a disinfected dirt. Therefore, if you see dirt, you must remove it, or you have not disinfected. Dust is a prime example. Dust carries harmful microorganisms and allergens. Also, dust easily becomes airborne, thereby spreading its harmful bioburden to patients, visitors, and medical staff. Look for dust on all horizontal surfaces that it settles on. In dusting, however, take care not to let the dust get airborne. This is especially the case for the occupied patient room. Dusting ledges and vents near the patient or guest should be deferred until you perform the between-patient discharge cleaning of a room. To kill the microorganisms living in objects and surfaces, follow these important steps. Be sure you have prepared your charging bucket and microfiber wipers properly. Never overfill the bucket. Put just enough solution into the bucket to soak the microfiber wipers. The level of the cleaning solution should not go over the tops of the wipers, and the wipers should not be submerged under the surface of the solution. Also, once you use one of the microfiber wipers from the charging bucket to perform your cleaning task, never return it for a rinse out in the bucket. This will contaminate all of the other clean wipers. Use your wiper to clean one area, surface, or object. Then place it in your liner cart bag with the dirty linens for laundering. Last thing, regarding microfiber wipers, note that you have two colors, blue and orange. Blue is for room cleaning. Orange is for bathroom cleaning. Avoid microorganism cross-contamination and always follow this simple color code rule. Always allow for adequate wet dwell time of whatever disinfectant cleaner you are using. Wet dwell time is the amount of time necessary for the disinfectant solution to remain wet on the surface you are cleaning to kill all of the visible bioburden living there. For neutral disinfectant cleaner, the wet dwell time is 10 minutes. For CaviWipes 3, the wet dwell time is 3 minutes, and for CaviWipes 1, it is 1 minute. Last thing, in patient rooms and medical procedure rooms, do not use a trigger sprayer, aerosol sprayer, or any other type of spraying or misting to apply cleaning solutions. Spraying and misting of solutions can be very harmful to patients' lungs, sinuses, and respiratory systems. While spray application can be used in Stroger administrative offices, public bathrooms, and other public areas, it should never be used in patient rooms, procedure rooms, or other medical areas.
At times, you will encounter a spill of blood or bodily fluids in your work for Stroger Hospital. It is your responsibility to clean and disinfect spills like these safely and thoroughly. Be sure to take the time to review the Stroger Hospital Training Module number 24, entitled Blood-Borne Pathogen Cleaning, for a step-by-step protocol for cleaning blood and bodily fluid spills. As a quick review of the important points of Module 24, remember the following. Use full PPE for cleaning blood spills, including gloves, mask, eye protection, and coveralls. Sprinkle an ample amount of the product Super Sorball on the spill so that there is enough to fully absorb the fluid. Once the fluid has fully absorbed into the Super Sorball granules, sweep up and dispose of the granules into a red medical waste liner. Apply neutral disinfectant cleaner to the spill area and put enough down to allow for the full required 10-minute wet dwell time. Wipe up the spill area using disposable wipers and dispose of the wipers into the red medical waste liner. For larger spills, use a flat mop to wipe up the disinfectant. Dispose of your gloves, mask, and coveralls in the red medical waste liner. Repeat disinfection if necessary. For example, if there is a visible residue, film, or streaking left on the surface where you have performed the cleaning.
Making sure all carpeted areas are clean and well maintained. Carpets should be cleaned on a daily basis, picking up loose particles or dirt that has been trapped by the carpet. Vacuum cleaners should be checked on a daily basis, making sure a vacuum bag or debris container is properly emptied. Also, make sure any hoses or seals for the vacuum airflow are not leaking in any way. A leak in any part of the airflow of the vacuum cleaner will circulate harmful dust into the indoor air of Stroger Hospital, and this must never be allowed to happen. Carpets should be spot cleaned as needed to remove spills and stains. If you have made your best effort to remove a carpet spot and it is not coming up, report this to your supervisor. Full instructions for spot cleaning and carpet cleaning can be found in the Stroger Hospital Training Module number 28, Carpet Care. Thank you for joining us in Stroger Hospital's Training Module number 4, Cleaning the Infection Control. We hope this video training was helpful and informative for you. If you have any questions, please be sure to ask your supervisor.